Hi, welcome to Cowesett Chiropractic. I'm Dr. Rick Jardon. I just wanted to invite you to the website. I think we have some interesting things on it. I hope you explore that. But let me tell you a little bit about myself. I'm a native Rhode Islander, went to LaSalle Academy, and then did my pre-medical education at the University of Vermont. From there, I got my doctorate at the National University of the Health Sciences outside of Chicago. In 1986, I returned to Rhode Island, took my board, and have been practicing since that time. Obviously, I've been a patient, and I've been in pain, and there's nothing more important when you are in pain to get in to see your doctor immediately. I've done everything I can to train my staff to make sure that we try to get you in on the same day and get you pain relief as soon as possible. So call our friendly staff to get the help that you need. If you've never been to a chiropractor, here's what you can expect. You know, everyone's condition is specific. So we will do a detailed consult and examination so that we can pinpoint exactly what is causing your symptoms. After the initial consult and examination, we often send you for diagnostic testing, such as X-ray or MRI, to help pinpoint the real cause of your complaint. And if you are in significant pain, we'll provide some treatment to give you some relief that day. Most neck and back pain conditions consist of problems with muscles and ligaments, or discs, nerves, and joint conditions. One of the most common conditions that we see is called sciatica. The problem is that sciatica just means pressure on the sciatic nerve. It doesn't tell us what's creating that pressure. Is it a disc that's pressing on it? Is it arthritis in the spine that may be causing pressure on that sciatic nerve? So we have to do an examination to help determine that. We stress various tissues and see if we can reproduce that sciatica. So I've got John here that's going to help demonstrate. But this is just part of the exam that I would be doing. We'd first start off with what's called a straight leg raise. And we know that sciatic tension comes on in the last third of that motion. So we can see if that reproduces some of the pain. And then, John, if you can cross. We'll also check the hip rotators to make sure that they're flexible and not creating pressure on the sciatic nerve going through the hip and buttock area. We can check the flexibility of the gluteal muscles. Again, the sciatic nerve travels underneath those gluteal muscles, so if it is tight, that can create some sciatica. And then we do things like double leg raises, which give us an idea of whether the pelvis is involved. And then, John, I'm going to have you hold your legs and then lower steadily. And we can see things like the strength in the abdominal area and how steady that person's able to bring their leg down for control of the stomach muscles and their core. So that's just a part of the examination that we would do, and we'd have you doing some standing up in prone positions on your stomach and palpating where that pain might be coming from. So for the sake of this video, I've just demonstrated part of the examination, but we do things like having you stand and doing a variety of movements to see if we could reproduce that sciatica. We'd have you face down, doing some different things that affect and put stress on that sciatic nerve at different points. So we can, again, help determine what's causing that sciatica. We're also associated with Sport and Spine Physical Therapy. I'm standing in their adjoining office, and they provide most of our rehabilitative services. So here at Cowesett Chiropractic, we take all insurances, we'll get you in quickly with a friendly staff that'll give you the relief that you need.